What is a beta blocker? In this Your Heart in 90 Seconds, I will explain what beta blockers are, how they work, and what they are most commonly prescribed for. Don't forget to subscribe and click on the bell so you get notified when we release a new video. So the names of beta blockers end in OLOL. Some common examples are metoprolol, bisoprolol, atenolol, carvedilol. There are others, and don't get confused because every drug has two names. What beta blockers basically do is they block the action of adrenaline. So adrenaline gets us revved up. What beta blockers do is they will slow your heart rate down, have it pump with a little bit less force, and they will relax the blood vessels that your heart pumps into. The most common side effects of beta blockers are fatigue, which we often get over a couple of weeks after starting them. Sometimes they can affect our sleep a little bit. Weight gain, might feel dizzy, cold hands or feet. A less common would be erectile dysfunction or depression. Now, a couple of common things that you have to watch out for. Physicians don't often prescribe beta blockers for people with asthma because they can also work on our airways. So if you are asthmatic and you're on one and you start to become more short of breath, you definitely need to talk to your physician. And they can block the symptoms of low blood sugar. So if you're a diabetic, you should check your sugars very regularly to make sure that they're okay. Now, beta blockers are prescribed for a number of reasons. They can be to slow down an irregular heartbeat like atrial fibrillation or atrial flutter. They can be used after a heart attack to help your heart recover from your heart attack. They can be used to treat angina so that it slows your heart down and it doesn't need as much fuel. They can also be used to treat heart failure, again, to try and take some of the strain off your heart. Heart failure is when your heart is weak. And it can be used to treat blood pressure, although it's not a first action drug. Usually they use a whole bunch of other ones first, and if they don't work, or if they want to add more on, they may use a beta blocker to treat high blood pressure. Now, words of caution, please do not start, stop, or change medications based on this talk or any other information that you find. You need to sit down and talk with your physician if you're having side effects. They may change medications, change doses. Don't just start, stop, or change medications on your own. You could have terrible consequences. However, if you are getting a true allergic reaction where you get rash, itchiness, if you're getting swelling, especially if it's in your face or your mouth and it's affecting your airway, call 911, get to your emergency department as soon as you can. I hope you found this helpful. We will talk again soon.